LSEC serves students with severe developmental delays and orthopedic challenges. They have an administration, support department, instruction, and provide residential and care services on a 24-hour basis to students throughout the year. Their budget is heavily tied to student enrollment and residents, so that's why you see some of those increases in recent years. They recently opened a new dormitory that's garnered some interest from parents to send their kids there. HB 105 recommends them for a slight decrease in interagency transfers, which they receive primarily through Medicaid, a small amount of IDEA dollars from the Department of Ed. They also receive some $75,000 from the Education Excellence Fund. Their FTE positions over the past 5 years has hovered just under 200 positions. Miss Christy Flynn is here, and she can speak to the program and answer any questions.
Hi, my name is Christy Flynn, and I am the director at the Louisiana Special Education Center. We are one of the special schools in the special school district, and our primary focus is students with orthopedic impairments. We have a special license from the Department of Health that allows our students to stay until their 32nd birthday. This year in legislation, we are hoping that our license is expanded to 37. The Department of Health has already issued that license, but it has to go into legislation. So we get a lot of work done with our students between their 22nd birthday and their 32nd birthday because so many of them are medically fragile with their orthopedic impairments, and our kids do things sometimes a little bit later, and they need extended time, and we have really had a lot of successes between 22 and 32. This is Cherie Bartell. She is the director of our health services, and I will let her speak as to we are an ICF, an intermediate care facility, and also a school, so I will let her speak to the intermediate care facility part.
Good morning. Again, my name is Cherie Bartell. I'm the Director of Health Services at the Louisiana Special Ed Center. I've been out there about 20 years, and over the course of the 20 years, I've seen our population change so that we are now serving a much more medically fragile, medically complex population of children and young adults. We serve some of Louisiana's most vulnerable students. Not only do we provide special education services, but we provide a lot of medical services as well as personal care services. And what we do is we take our daily per diem and bundle our 24-hour nursing care, a team of physicians, a team of therapists. We provide for their durable medical equipment, and we provide all of those services so that the students' medical needs can be met, so that they're medically stable, so they can get up every morning and attend class and participate in their daily activities and participate in their community living. We provide services that these children typically don't have access to in their community schools and in their community homes. We have some that were on the waiver services yet did not receive the access that they needed, and these children do well at our facility. We provide case management services. Each student has an RN case manager that's assigned to them, and that case manager's responsibility is to coordinate all of their health care and to be the liaison between the medical services, the therapist, the personal care attendants, as well as the education staff. And so that model has served us very well. What is very unique about our facility is that CMS, the Centers for Medicare and Medicaid, across the state are asking that as the health care moves forward in the United States, that they're using a system of bundled care. And we already do that. For once, Louisiana is on the forefront. We provide all of those services within that person's daily per diem that they draw from their Louisiana Medicaid dollars. And so we're able to provide services that nobody else is, and provide a very, very medically complex and fragile population access to their day, their community, and their education program. Any questions?
Yes, ma'am. Representative Harris. Thank you, Mr. Chairman. Good to see y'all. Y'all do a great job over there. That's if anybody gets a chance in Alexandria, need to go check this out. This is really a very good school that Louisiana has. I have a question. Last year we authorized some more positions through the Medicaid, and that I think it was 22, something like that. How are your vacancies coming? I know that y'all have to provide direct care to these students. It's totally different than just teachers, but can you kind of give us an update of where we are with that?
Yes, we're 24 hours a day, 7 days a week, weekends and holidays. It's very difficult for many of our students to go home because of the level of care that our students and residents have. Many of them are enteral feeders, and they're in specialized wheelchairs, and parents just don't have the adaptations or nursing services to provide that care to them at home. So a lot of times families are visiting our students at our residential facility. So direct care is there all of the time. Our teachers are not there all the time, but our direct care is there 24 hours a day, 7 days a week. We continue to work with civil service because the pay in direct care, it is a low paying position. The turnover, we have more attrition in that position than we do in any other positions. But we continue to work with civil service to look at ways to enhance pay for our direct care. And I would say we're coming along. We're not there, but we're coming along in the area.
Very good. Well, good to see y'all. Thank you for coming in.
Thank you.
Representative Smith.
Thank you. Couple of questions. I'm not going to go back to the vacancies, but would you say that these vacancies pose an issue at your school for safety? There have been a couple of issues at
Yes.
the school, and wouldn't this impact the safety issues at your school by having all these vacancies?
I would say that probably a small part, but we're able to work some of our direct care. We have the opportunities to work overtime, which that's always been an issue at our school, and we have people who willingly want to work additional shifts, night shift, the evening shift. But I think safety-wise, we have everything covered with the staff that we have. It would just be nice not to have to use all your extra money in overtime.
And the other question is, you receive no MFP dollars. You receive Medicaid and you receive IDA funds.
We receive Medicaid funds and one educational excellence grant, right?
Well, you do get some IDEA, the special ed funds. You don't get any special ed funds? Oh, okay. So that's
the 8G grant?
No, AG
Oh,
grant.
the AT grant. Yeah, we have that on campus. We house that.
Right, okay. Just want to make sure that Tim wasn't giving us the wrong information
No,
there.
sorry, we house a grant on our campus.
So my question then goes back to educationally, where do these young people, and as they go into adulthood, fit into society once, or do they leave your facility? And when they leave your facility, where do they fit into the society, into our society, as far as any job opportunities or what have you? Give me an example of some of the things that they're able to do.
Well, we have a student that graduated recently, and we were able to partnership with the local school district, Rapides, and she attended ASH, but we were able to take care of all of her health care needs. Where she went to school, her family was not able to take care of her health care needs, so we were able to address that. Partnership with the local school district, she went out to typical school, and then we provided all the academic supports at our center when she returned. She's graduating from Louisiana State University at Alexandria. She's orthopedically impaired. She's in a wheelchair, and she will be receiving her associate's degree in May. And she is working part-time, I believe, in mass communications, and she's looking to forward to go on and get her bachelor's degree. But for the majority of our students, they're so medically complex that, and we have a lot of enteral feeders. There are not a lot of group homes that service these kinds of students and young adults. And it makes it very difficult, even though our social services department works they work in direction with the families to try to find placement, generally the only placement you can find is a nursing home, and that's a very inappropriate placement for somebody that's 32 years old. So it definitely is an issue.
Right.
And I can let Cherie speak to that a little bit more.
Yeah. Please do. Yeah.
Yes, so transitioning into community living is a challenge for our population. They require 24-hour support services. Many of them, and Christy keeps referring to our enteral feeders, those are the individuals who are fed not by milk.
Right.
And so what that means is a lot of them require more care, whether it's a nurse or a certified medical attendant. Our population is much more medically fragile and has a high incidence of reflux, which further complicates their nutritional needs. And there are just not a lot of community opportunities for them, and that is a challenge that we face. We do understand that it is our purpose and our mission to help prepare them for community living. But one of the primary challenges is on the receiving end, there are not a lot of opportunities for them. There are very few what is considered medical homes, and that's a home that has 24-hour nursing care. And we have been in communication with a lot of the group homes, and they always come back to us and say that the funding is not there for them. And so in the end, it's really just about them not having the financing to be able to provide the level of care and the opportunities. And it does create a challenge with us trying to partner with community and help the individual maximize their independence and reach that self-actualization.
So that's something else we'll have to work on.
Yeah, I'd be happy to.
Yeah, well, and I say that because you're absolutely right. Going into a nursing home at 32 or 37, whichever age it is very difficult, because then that limits them again of any particular kind of societal influence, because they're bound to be at that nursing home until their demise. And so that's just not something that we should be thinking about. We ought to have some kind of community-based program so that they can get into. Yes. All right. Thank you very much.
Thank you.
Representative Hodges.
Thank you, Mr. Chairman. Thank you, ladies, for being here. I have a question for you. You said the number of students have grown and they have changed. Can you tell me just a little bit about that? Like how much has it grown, and what has changed?
When the school was, its inception was 1948, and your typical public school didn't provide services for kids with cerebral palsy and that type of disability. And over the years, public schools have become more aggressive in the way they take special ed kids, and they're able to provide. So over those many years, our kids were walkers at one time with cerebral palsies, and they used walkers or crutches. But now the majority of our students are in wheelchairs. So it's just we take a more medically complex student. And I can let Cherie speak to that.
Yes, the population that we're admitting now are much more medically fragile. I would say about 80% are enterally fed. I would say about 80% of the new admissions are non-ambulatory and nonverbal. Right now, 55% of our total population is enterally fed. Over 80% have seizure disorders, which means that if you had a child in a typical community school and they had a seizure during the school day, it's highly likely they would have to be sent home for the day to seek medical care. In that instance, in our school day, that child would be sent down to the nurse's station. They would receive a nursing assessment. They would contact the physician. Once the child was medically stable, they would go back to class. So what that means for them is fewer missed school days. But it also means for us that we're receiving individuals that are much more medically complicated. Even though they have to have an orthopedic impairment as their primary diagnosis, there are multiple secondary diagnoses that come along with that. It can be reflux, it can be seizure disorders, it can be a brain shunt, it can be a cardiac anomaly, it could be a renal anomaly. And so, and in addition to that, because our individuals have an orthopedic impairment, we have a high incidence of individuals that have scoliosis as well as hip impairment. And so for them, what that means, especially for a young child, is typically a lot of surgeries. And that is one of the roles that the case manager functions in terms of coordinating all of that care between our team of medical specialists and teams of medical specialists throughout the state. We access Children's Hospital a good bit. We access the LSU Shreveport system a good bit. And usually I would say from 3 to 20, a student can undergo anywhere between 1 to 3 surgeries, and our teams coordinate all of that care.
What is the typical age that a student would come to you?
We are licensed 3 to 32. Our admissions process does not take any student that has graduated from high school, so you have to be admitted before you graduate from high school. But the average age is puberty for girls and boys, so I would say between like 11 and 14, and that's when you really talk with families and the services that they need in their home, the lifting of the students, the coordination of medical appointments and care is not in the community where they're from. So we have a lot of 13 and 14 and 15-year-olds. That's where we have seen our population grow this year.
Well, thank you very much for what you do. I know it's a difficult job, but thank you for stepping up to and doing that. Thank you, Mr. Chairman.
We say we have the best job.
Representative Billiot?
Yes, my questions were just about the same as Representative Hodges. The age group, you say they're coming in mostly at 13 to 16, and those and the parents are really living away, and you have to care for them. So. Thank you for all what y'all do. I mean, it takes special people and your staff and everyone who's associated with this group. Thank you so much, because these kids need somewhere to go, and y'all provide that care. Thank you.
All right, board is clear. Thank you.